to adjust your volume. And I'd like to turn control of the presentation now over to John Hickey. Take it away, John.
All right, Dan, thank you. And thank you for allowing me to speak today. I think one of the first questions that Dan asked me when we first started this is, what's new? What's going on out there in an Affordable Care Act and healthcare reform? And I can honestly tell you right now, nothing has changed in the previous months. And so what we're going to talk about is what we're doing moving forward, and knowing that 2015 is upon us. I mean, I'm already starting to get renewals on 2015 as of today. So we are here, and I'm going to also talk a little bit about what's going on with the exchange, Medicaid, Medicare, and those various programs. So when do you have to offer a plan? Well, in 2015, employers with 100 plus full-time equivalent employees must offer health insurance. In 2016, if you have 50 to 100, it'll be your turn to start offering benefits for full-time employees. But until then, you can offer it at any time. Now, the trick here is that if you're already offering benefits before, and you offer it to at least 1/3 of your employees before December 27th of 2012, then you can offer it at your renewal date. If you have a calendar renewal, let's say March 1st, 2015, you will have to offer benefits to those that are on a plan now on January 1. If you have at least 1/4 of the employees enrolled on December 27th, 2012, then you don't have to do it until your renewal date in 2015. If you do not have 1/4 of your employees enrolled, then you'll have to offer it January 1st. So it's almost like having two open enrollment dates. Those that weren't on previously that need to be eligible now, and then go back to those that are on the plan now for your open enrollment date in 2015. I know it sounds a little confusing, but we're going to talk about knowing your numbers and why you need to know your numbers and when you need to offer plans to your employees. Here's an important chart that everyone should look at to determine if you need to offer benefits, if you do, when you do it, and are you offering an affordable benefit. So first you need to ask yourself, do you have 100 or more full-time equivalent employees? If you don't, this mandate does not apply to you. If you do, are you offering it to at least 70% of your full-time employees? Now that number had changed from previous years. It was 95%, but now it's gone to 70%. If you are not offering it to 70% of your full-time employees, you would be subject to a penalty if your employee does go and gets a subsidy. If you are offering it and your employee's household income is between 133% and 400% of federal poverty level, then you could be subject to a penalty if you do not have a 60% actuarial value plan or you make it unaffordable. The biggest question that I get about how do I know what my family income is you don't. You're not going to know. You're going to have to set these guidelines up by what you know from your employee's income. If you have to pay a $3,000 penalty for it being either unaffordable or inadequate, you will never pay more on that $3,000 penalty than you would the $2,000 penalty. Now, what I mean by that is if you're not offering a plan, you pay the $2,000 penalty for every full-time equivalent employee, that's not going to be, the $3,000 penalty is not going to be any more than that maximum $2,000 penalty. So it won't be as high as the $2,000. Paying the penalty. I have spoke to many CFOs and controllers out there just as, why don't I just pay the penalty? It's much cheaper than actually paying for benefits, and they're right. That paying $2,000 for a full-time employee would be cheaper. It's basically the easiest way out of healthcare reform if the mandate 2015 still continues to go through. And it's also less expensive than the average insurance premium of $6,029. But I would probably tell you it's around $4,200 for a single employee here in the state of Washington. Also, that the IRS forms are out that you'll have to report. So for the employees that aren't going to be on a plan in 2015, that you will have to report in 2016. There's two forms that you will need to fill out. one for those that are offering it or one for those that are not offering benefits. So why do you want to offer a plan? Well, the biggest thing is offering a plan. You are recruiting and retaining your employees. We do know that there are some competitive wages out there, and we also know that the employees like to talk to each other. So if you are an employer that has orchards and your employees are out there working, they do talk, and they could switch positions and jobs based on either their education of higher incomes or if another employer is offering a benefit. So you need to be careful and know what's going on in your surroundings so that you can offer a competitive benefit to keep your key employees. So the biggest thing, as I said before, is knowing your numbers. How many employees do you have? Full-time employees plus part-time hours divided by 120 would equal your full-time equivalent employee. I get a lot of questions saying, well, I only have some employees that work for 2 to 3 months. Do I have to count them? Yes, you have to count the hours. How many are hired as full-time? You should know that your employees are going to be full-time. If they're salaried employees, that's full-time. If you are hiring somebody that you're just not sure what their hourly work environment is going to be, then they're going to be considered variable hourly employees. If you are hiring somebody just for that particular season, it would be considered seasonal employees as long as they are not working more than 6 months. So you need to be careful on how you're managing these employees. Again, if they're full-time, you most likely have to offer them a benefit. If they're variable hourly employees, you're going to have to monitor their hours to see if they hit that requirement for benefits. And then your seasonal employees, you're also going to have to monitor. Again, I get that question of, I only run cherries. Do I have to offer to my seasonal employees? Most likely you're not. But if you're doing cherries and pears and apples, then you need to be careful of how many hours these employees are working because you may have to offer them benefits. The other biggest question is H-2A workers. How are H-2A workers counted in this? Well, they are here legally and under contract, so you need to be careful that you're not having them here past 6 months. Once they're here past 6 months, they may not be considered seasonal employees anymore, and you may have to start worrying about offering them benefits. So I also want to talk about what coverages are out there. There are many different types of coverages by offering health insurance. We have fully insured, self-insured. We have Medicare, which a lot of employees are confused, the difference between Medicare and Medicaid, and sometimes even the employers are confused. Medicare is our country's health insurance program for people at age 65 or older. This is big because some of the companies that I work with that are smaller groups that have maybe 20 employees on the plan, that these rates are driven by the age factors of the employees. Now that these smaller groups with healthcare reform are starting to get age-banded rates, meaning that the composite rates aren't there anymore, they're all listed by your ages, that 65-year-old person and older is a lot more expensive than they realize. So what I always tell them is to educate the employee, if they are 65 or older. You cannot push them off a plan, but you can educate them and let them know that maybe their plan on Medicare could be just as good, if not better, than the plan they have on the insurance. So again, be aware of who's on the plan. And with TRICARE, TRICARE is used for military members and families. Now the reason why I talk about these programs is that if an employee is on this program, they will not count against you moving forward. So if they are on Medicare or TRICARE, and even Medicaid, they will not count against you when it comes to health care reform. Medicaid, which is a new name, which some of you may have heard, is called Apple Health. That's a state-run program. Now, don't confuse this again with Medicare. I hear that all the time of saying, well, I'm not 65, I can't get Medicaid. Medicaid is basically you're eligible by your income. Information needed to qualify is your household monthly income, a social security number, date of birth, and your immigration information. Now, in the state of Washington, that we have accepted a 3-year subsidy by the federal government to start our own exchange program and to help out the Medicaid expansion. So what that means is that the federal poverty level has expanded so that if an employee's family makes less than 133% of federal poverty level, they can qualify for state subsidy under Medicaid. Because of that, the new numbers that are out have 285,000 new adults have enrolled on Medicaid in the state of Washington. And that number came out in March. So Medicaid has helped out tremendously for members who have not had insurance, and I believe it would help you as an employer out as well, finding a benefit that you, the employer, will not have to pay for. So I'm sure some of you are asking the question of, well, how do I know the 133% federal poverty level? Here's a chart that we provide when we do our renewals that gives you a 2014 modified adjusted gross income. Again, if the employee's household income is less than 133%, they would qualify for Medicaid. If an employee's household income is between 133% and 400%, then they would qualify for a subsidy on the exchange. That means a family of 5 making $111,000 could receive a subsidy on the exchange. This chart will change each year based on CPI, so they usually don't release that until about the beginning of the next year, so stay tuned for 2015. A lot of questions we had was on the marketplace, the exchange. They don't call it the exchange anymore for whatever reason. It didn't translate in different languages to the proper term, so they call it the marketplace. The marketplace did close on the end of March this year and had a great enrollment, and that's why Obama wanted to extend these mandates so they can get more people on the exchange. Now, overall, nationwide, I believe they had about 7 million members join the exchange. And I'm not sure the exact number here in the state of Washington that joined, but that's why they did. They also allowed the members to enroll in just individual plans, not exchanges, but the individual plan on the carriers. That also had the same open enrollment period. The difference with the exchange and the individual plans is that the exchange, or excuse me, the marketplace, had what's called a narrow network. So the network was not as large as what a lot of you are used to in an employer atmosphere. So the network is narrower, therefore it should be a little cheaper for them as well. Also, what we're hearing is that the prescription drugs was not as strong as it would have been outside of the marketplace. Open enrollment for 2015 exchange plan is going from November 15th to February 15th. Now, this is the only time that you can join without having a qualified event. So I know a lot of employees may have said before, I want to jump on the exchange now that I'm aware of what it is. I didn't know about it that much in the previous 3 months. They cannot join right now. They can only join on a qualified event, very similar to your benefits and when you can make changes. So if the employer drops their plan altogether, an employee can join the exchange at that time if they're on that plan. If COBRA is running out, they can jump on the exchange at any time after COBRA is terminated. I did hear that the average premium after subsidy is around $84 for the employee. I've also heard news reports that the projected increase for premiums in 2015 is around 20%. And do not forget that a subsidy is not allowed if an employer is offering that employee a benefit. So what does that mean? Is that if you're not offering your employees this year a benefit, they can get that subsidy. We're going to get into 2015 and 2016 where the employer will be offering benefits to the employees. That employee will now lose a subsidy from the government because the employer is offering the plan. Also, the employee may be getting subsidy from the spouse and the children. So one thing that you can do as a large employer in 2015 is not offer a benefit to the spouse. The rules state that you have to offer a benefit to the employee and their children. It does not state that you have to offer it to their spouse. So you as the employer can elect to not offer coverage to the spouse. You can also elect not to offer coverage to a spouse if the spouse is working somewhere else and has coverage. So there are many different ways around of how you can do it for a spouse. Now, it also states that you don't have to pay for the spouse, nor do you have to pay for the child. You just have to offer a benefit to the child. So I'm going to talk about the different plans that are out there now as an employer-paid option. Many of you have fully insured plans, which means that you basically pay a premium monthly to the insurance carrier, and you're making sure the insurance carrier pays the claims appropriately. So pretty much it's out of your hands once you make that payment. Now, you're obtaining your coverage either through the carrier directly or you're going through a trust or association. The Farm Bureau is one of those trusts, as well as an omni-trade trust for the ag industry. Again, being fully insured puts full fiduciary responsibility onto the carrier. The problem with fully insured plans are you get renewals every year. A lot of times you're not sure why you're getting the double-digit increase that you're getting. And some of that also is the new PPACA mandated taxes that are in there and other benefits that you have to include. So don't be surprised in your fully insured renewals you're getting 14% plus increases due to the mandates. As I talk about trusts and associations, as of 2014, trusts and associations must be industry specific. Therefore, that if you are in the ag industry, you cannot join a trust association that does hospitality industry. So you have to be specific to your industry. As I mentioned, Farm Bureau and OmniTrade offer industry-specific plans for the ag industry. These trusts are renewing on 1/1. So what does this mean? Is I have clients that have currently, say, a July 1st renewal. They are getting a renewal for 5 months until January 1, and then we'll get another renewal. So the majority of these trust associations will be renewing on January 1st. So some of you will be getting a short plan year renewal and then additional renewal January 1. I use that example of a July 1. This group received a 12% increase from July to January 1, and then they'll get another increase in January 1, and that's just across the board of the trust. It had nothing to do with the actual client. It was trust spread out. They will go off of your NAICS code. That's how they place you in that trust. So if your code is not correct, you might want to make sure that it is correct now. There are various trusts out there that will not be offered in 2014, so you will be getting a non-renewal from that trust, and maybe the trust manager who is responsible for another trust will try to move you on to something else. Now, I have seen renewals of 50-some-odd% increases just by trying to move them away from that trust that is no longer viable. So I'm not saying we're going to move them over to that, but this is what's going on in the market. Another discussion that we have with our clients is going from a fully insured platform to a self-insured platform. Now, what I've shown up here on this chart is what it looks like in a fully insured arrangement compared to a self-insured arrangement. On a fully insured arrangement, I mentioned before that you're going to pay a premium to the insurance company. By paying that premium, you're banking that that carrier will be paying all the claims for you. No questions asked. But here's what's made up of that premium. About 60 to 65% of that premium goes towards your claims. You have 3 to 5% goes into claim reserves. Admin fees are up 12 to 15% of that premium. A pooling charge, which is another name for a stop loss, is 8 to 15% of the premium. Then you have premium tax of 2%, which actually they're going to be adding an additional 2% to that here soon. And then they have the margin. Now the margin is what's called the fluff, and that's kind of where the fully insured carriers kind of make their money, is off of that. You go down to a self-insured arrangement with stop loss. This is where the employer is paying the claims themselves. And that could be like a weekly claims dump that you have that the employer will pay for it through a third-party administrator. So there's actually somebody you're hiring to administer those claims, and then providing a stop-loss carrier. And that stop-loss carrier is the one who protects you from the high claims. 100 employees plus will see data with fully insured arrangements, and on your self-insured arrangements, you should receive data from the broker on your claims. That should be monthly and quarterly. You should see that. On the fully insured, depends on how large you are. You probably won't see, if you're smaller, you won't see your data probably about maybe once a year, and if you're larger, you could get that on a monthly basis. The big thing, again, is to know your numbers and what's a good fit for you. With self-insurance, though, the kind of the short answer of why do you go self-insured is to save money long-term. And that's the biggest question everyone always asks is, why should I do it? I don't know if I want to be the one really paying these claims out, but if you want to save money, you should probably look at going self-insured. There are 2 clients of mine this past year that have been fully insured that have 250 employees or more. We ran analysis for them, and on both of these clients found that over the last 5 years, if they would have been self-insured, they would have saved $1.1 million. So there is money out there for you to save. Now, you're going to have a bad year, and that happens. Everybody has a bad year, and then you're still building your plan to absorb that bad year. But when you go into why self-insurance, when you go to self-insurance, you get out of paying the state premium tax on the premium. So there's your 2 to 4% that you're going to save right there on your premium by going self-insured. You also hold your own reserves. The carrier does not hold that. The margin and risk and fully insured plan generally includes a 3 to 5% margin. Again, that's the fudge factor on there. So we believe that you, being self-insured, can save on that cost. Also, when you're self-insured, you can pretty much build a plan that you want to build. You don't have to go by the carrier's answers of putting these plans into place. You can build it and get away from some of the state mandates. You have to make sure that you still have the federal mandates in place. And then the biggest thing is your cash flow, that you're better off over the years with the cash flow of going self-insured. So why isn't everyone self-insured? Well, a lot of times the employers can't absorb the high claims cost, or they can't absorb the way that the cash is being needed to pay the claims. So when you build a model to figure out if you need to go self-insured, you have to be prepared to pay claims out on a weekly basis. You also make sure that you have a stop-loss vendor in place too. Now again, the stop-loss is pretty much what the pooling point is on your fully insured carrier. So depending on your size, that you could have a very low stop-loss amount of, say, $25,000, and if you are a larger employer, you could have a stop-loss amount of $125,000 or larger. Many times, the carrier will pick that stop-loss amount for you. For you small employers that are looking about going self-insured, 2 carriers, Primera and Cigna, have a plan which is called a level-funded plan, where you pay premiums monthly like you do on a fully insured product, but it's a self-insured run claims. So in the background, it's being run like a self-insured plan. What you do is you get a credit at the end of the year if you run well, and they just credit your admin cost. So if you're kind of scared of jumping into a self-insured model, then you can jump into this level-funded plan and still pay your premiums monthly and still get your data that you want each month, and then get credit at the end of the year if you run well. Now on a fully insured, if you have high claims, you can leave that carrier at any time, and that carrier takes responsibility for the claims. On a self-insured model, that those claims run with you throughout the year, or is responsible for those claims. Here are the 2 different versions of a stop loss. You have a specific stop loss, which means that that stop loss will be, as an example here, $100,000, meaning that you as the employer will be paying the claim up to $100,000 as an example. Anything over that is the carrier's responsibility. Now, some employers say, well, what if my plan just blows up and everybody utilizes the plan? What do I do from there? Well, that's why you have what's called an aggregate stop loss. That if your plan runs at 120 to 125% loss ratio, then the aggregate stop loss will kick in as well. Believe it or not, your fully insured premium is built on around 120% loss ratio. So you're already paying for that amount. Again, depending on your size, will be dependent on the pooling point or the stop loss amount for the employer. Now, why do I think that this stop loss and being self-insured is important moving forward? Because as you start offering benefits to the employees that are newly coming on this plan, that they may not be using it. So a lot of the employees who are not on it now, that will be on it later on because they have to be on it, may not use it. So if you're self-insured, you're only paying the admin cost and the stop-loss cost. You may not be paying claims because they're not utilizing a plan. If you put them on a fully insured plan, you can be paying the full premium amount no matter what they do, if they use it or not. This slide goes over plan design options that we've used for one client. I wanted to show you going 2015. As you see on the left-hand side, the current plan is $750 deductible plan. So it's probably very similar to a lot of the other plans that you as the employer may have. Knowing that on average it's probably going to be about a 10% increase, but we started looking at doing a minimum value plan. Now, a minimum value plan is trying to make one at 60% of actuarial value that the carrier provides to us. And this was a fully insured plan that we were looking at doing. And what we really wanted to look at was trying to do a base buy-it plan. Is let's try to offer something at the lowest cost to the employer that will provide a 60%, which would be the lowest amount of benefit allowed to the employee by healthcare reform. If we offered that plan and then offered a buy-it plan for maybe the key employees that you were paying before, what would that look like? And you're going to see that on a fully insured plan, at minimum value plan 1, the lowest amount we had was $373. So the employer is only responsible for paying 75% of that premium. The reason why I say it's 75% because that's the actual carrier's rule, not healthcare reform's rule. That they're going to need 75% of the premium paid for this plan to work out. Now the employee would have to pay 25% of the remaining premium, and if they wanted to buy up, then they'd buy up to that $531 premium. If you look on the right-hand side where it's in red, it says MEC plan. And that's the minimum essential benefit plan, and really all that is, it's covering 100% of preventative only. So that gets you at least to the MEC plan, that's $54. Will that work out for healthcare reform? The answer is yes and no. Yes, by offering that and it's affordable, you can do so. The only problem is that does lead you to possibly getting a $3,000 penalty to any employee who goes to the exchange to get a subsidy. So yes, you can offer it, but you will be penalized for that. When we talk about adequate and affordable, that to have an adequate plan, you have to make sure that your plan covers 60% of the total cost of benefits on there. Now you're going to ask yourself, well, how am I supposed to know if it covers 60% of total cost of benefit? That's what our job is as a broker. The broker should be doing that to make sure that your plan is adequate. Now, it's the employer's responsibility to make sure it's adequate, but the broker would be doing that for you. The carrier really doesn't care if you offer it 60% or not, so don't blame on the carriers as being their fault. And usually on their fully insured plans, they're going to be offering you that 60% actuarial value plan. It's the self-insured plans you have to be careful of because remember, you as the employer are picking and choosing what plan you want within that self-insured model. So ask the broker to determine if it's a 60% actuarial value. Now how we do that is there's actually a website we go on to for Health Human Sources, and that we can plug in your deductible, we can plug in the co-insurance and co-pays, and that spits out what your actual percentage is. But to make it affordable, that there are 3 safe harbors for you to choose. And this is something that we also do at MCM to determine what the safe harbor would be. But you have to pass pretty much all 3 of these to determine that if 9.5% of the employee's W-2 wages, excuse me, back up for a second, the premium cannot be any more for the employee than 9.5% of their wages. So if your premium is going to be $200 towards that employee, most likely that's going to be unaffordable. So our job as a broker to you as the employer is to make sure that the percentage being paid by the employee is still affordable. So you're really going to have to watch those that are on minimum wage. And then with minimum wage increasing each year, that means that your cost is going to go up each year as well on the premium. So basically we're going to ask the question to you as the employer is, what should you be doing now? The biggest thing is you need to know your numbers. I keep saying that over and over again. That manage your numbers, manage your employees. You're going to have to do a testing period for your employees. Each employee is going to have a different measurement period. So you need to ask your payroll vendor if they will help you. You need to ask your broker on what they can do to help you. And there may be third-party vendors. I know you as an employer have so many employees coming in and out They could be there for 1 week and not there the next week. They could be there for 3 months and then not there for another 3 months and coming back. You need some help to determine who's going to be eligible for benefits. Because once you determine who's eligible and they take that plan, they're going to be allowed to carry that plan even if they stop working with you. So you need to know your numbers and who you're going to offer it to, because January 1st is coming up really quick. I just sent out an RFP for a January 1 effective date in the ag industry, because since the population is changing so much, the carriers are taking it now knowing it's a totally new group going from 75 employees to 500 employees. Also, you might want to think about is if you are going to offer a benefit to your employees, are you going to offer it to spouses? You don't have to, as I mentioned before, offer it to spouses. You have to make sure that if you do offer it to spouses, are they not maybe have coverage somewhere else? So you can have them sign an affidavit if you want to close up the spouses, saying that they don't have coverage elsewhere. But you will have to offer this plan to the children, but you do not have to pay for the children or the spouses. But you will have to pay for the employees. Also, if an employee does not want the benefit, then you need to have them sign a waiver form to protect you. That in 2015, after the employee does their taxes, and they mark on their taxes that they did not receive benefits, then you will be notified as the employer. So you need to make sure that if you are offering them benefits, that you will be having them sign a waiver form. You can probably get those through your broker. You can make one yourself, but have them sign something that protects you later on. Are there any questions that I went over?
Oh yeah, there's lots of questions, John.
I'm sure there's going to be.
Okay, so first, if you could, I just got a couple of general questions, and then I'm wondering if you could back your slides up to the beginning, and then I could go through as we go. So the first question: if we don't offer coverage to spouses, does that mean the spouse is eligible for a subsidy in the marketplace?
Yes, that is correct. So that's why the employer needs to be careful that if they are not offering a benefit now to the employee is most likely getting a subsidy on the exchange. And so if you offer that employee coverage 2015, they will lose that subsidy. So it may actually cost them more to go on the employer benefit. So that's why we say strategize with the spouse that you don't have to offer it to them so they can receive a subsidy, because most likely that spouse's premium, because you're paying the full amount on the medical insurance, is probably going to be $350+ for that spouse. If the average premium with subsidies like $84, they're much better off going to the exchange.
Okay. So the 9.5% affordability rule, and we've got some more questions on that slide about the affordability rule, but the 9.5% affordability rule applies only to the employee, not the spouse?
Correct.
So it's the 9.5% of the employee's wage, not the 9.5% of the...
Yeah, so it's 9.5% of household, but you really have to go off, originally with the household, then it went back to the employee because the employers had no idea what the household income was. So it's off of the employee's wages.
Okay, so although although the law states household income.
It did state originally, and they changed it to make it 9.5% of the employees for the premium.
Oh, so the law originally stated 9.5% of household income?
Right.
But by rule, they changed it to, it's been changed, I guess,
yeah, so originally when the law first came out, they were saying that for affordability, it had to be like 9.5% of household income. But there's no way employers know the entire household income.
Right.
So they changed it for easier for the employers to know it's 9.5% of employees' income.
Okay.
And then I'm trying to find it here.
No, I get you. It just doesn't make sense to me that an agency can change the law.
Have you not paid attention to the news at all?
I guess, yeah, stupid me. Yeah, I know. I guess, yeah, I guess that was dumb. The president can do whatever he wants. I understand. We're not going to get into a political.
Yeah, and that was actually changed like back in 2010.
Right. I remember that. It just is kind of crazy to me. Okay, so I guess I've got a question that came in on slide number 6, the knowing your numbers. Okay, so the first thing is that the seasonal employees that the person hires are full-time employees. So do they have to do any of this variable hourly stuff on these on seasonal employees? They're hired seasonally, but they're full-time seasonal, so they just count as one person. Isn't that correct?
Yeah, so you're still going to count the hours that they work to determine. I mean, there's two determinations. One is, are you 100 plus FTE, full-time equivalent? You know, once you determine that, which a lot of you already know, if your full-time equivalent is 100 plus. After that, because then you're going to know if you're providing benefits in 2015 or 16, that if you're at 100 plus, then you worry about who you're going to be offering benefits to. Now, Dan, you actually kind of answered your own question because you said my seasonal employee is full-time. Well, of course they're going to be full-time for 1 month, 2 months, 4 months, 5 months. But because you have labeled them seasonal, that then you won't want to worry about offering them a benefit. Does that make sense?
Just want to make sure that the question here, and I kind of answered it already to the person privately, but the seasonal employee, they're working 60 hours a week, and they want to make sure that they don't have to count that seasonal employee as 2 FTEs.
Well, yeah, so it'd be considered an FTE calculation.
Okay, so
but the employee would not most likely be offered a benefit.
Right. So, I mean, they take the hit on that person as 1 FTE for the determination of whether or not the person is an applicable large employer, and then that person's going to count as 1 FTE during that time period, assuming that you're going to count because you have seasonal employees for more than the 4-month period. But then that person works less than 6 months, so they're going to count against you, but they're not going to be eligible for the benefit.
Right.
I think that's what the
right.
person. Okay. So that was that slide. Then. I thought it was interesting when you went through Medicare, TRICARE, and then Medicaid that you said that they did not count against the employer for having to offer benefits. So if I have an employee that works here and is eligible for TRICARE, I don't have to provide benefits for that person?
Right. So if they are on the plan, then like if someone's on Medicaid, so you don't have to provide a benefit to them. You can offer it to them, but if they don't take it and they continue to be on Medicaid, it doesn't count against you.
Okay, so
I mean, they have coverage elsewhere.
Right. Can I say that a person that's covered elsewhere doesn't get, if a person is on Medicaid or Medicare or TRICARE, then we're not gonna offer them insurance?
You can at least offer it. But if they decline it, then they're not going to be penalized, and neither are you as the employer.
Okay. What I'm saying is I don't want to offer it to these people.
But then how are you going to know who they are?
Yeah. Good point. Okay.
So that just really protects the employee too, as well as the employer. So if the employer does offer it and they waive it, if they have coverage elsewhere, like great, you're fine. So that's why I think that a lot of employers don't realize that, maybe on this call too, that you could have a couple hundred that you feel that are going to be eligible, but a lot of these could go towards Medicaid. Now, the reason why we talk about this is because we're trying to make sure we don't get any employees trying to get a subsidy that are out there. Now, when they go and try to fill out the information for the exchange and they have to fill out what their income is, they're going to be kicked to Medicaid. So that means they're not getting a subsidy for the exchange. They're going to Medicaid, and that doesn't go and trigger the IRS or the Department of Labor to come after the employer. Only when the employee gets a subsidy will that trigger something of the employer getting a penalty.
Okay. Just a quick verification on that second slide. We've had this one before. We've got a lot of employees that are in the greater than 50 FTEs, less than 100 FTEs. Person does the calculation, determines that they're an applicable large employer with 65 FTEs. Just want to verify that that no health care is required in 2015.
Yeah, not 2015, but will be in 2016.
Got it. Got it. I have one that I'm gonna answer and just kind of put out. What's the difference between a seasonal employee and a migrant employee in regards to health care coverage? There's no difference in my opinion, and you might tell me if I'm wrong. A seasonal employee and a migrant employee have different definitions in terms of labor law. The Fair Labor Standards Act, or actually the Migrant Seasonal Farm Worker Protection Act, is an act that's specific to agriculture, and it defines a difference between a migrant worker and a seasonal worker. But for purposes of health care, you just have people that are seasonal workers. They don't care if the person came to work for you from California and worked for you for 5 months from California, or a person came to you from Pasco and worked for you for 5 months. And one, they don't care. They're all seasonal employees. So that was a question that came in, and I think I was able to answer it.
Yep.
Then the next question I have came in, the self-insurance. I'm getting a lot of questions about self-insurance. So the first question that I got was when you first put up the self-insurance slide and you talked about stop loss, a person asked, is stop loss the same as reinsurance?
Yeah, you can kind of consider it reinsurance. I mean, it's there to protect you. So I gave the example of like $100,000. So you have the reinsurance that covers anything over $100,000. It's stop loss. The employer would be responsible for anything like up to $100,000. Again, that's an example. It doesn't mean every employer is going to have that stop loss number, but yes.
Right, because we have a lot of employees that have been calling me up and saying that they're been contacted by brokers and said self-insurance is the way to go, and I think a lot of them are saying it because of your slide 16 that self-insurance plans can choose not to pay state-mandated benefits.
Right.
I guess you're hearing that a lot too. You might want to talk about that a little bit on that
slide.
Yeah,
so there's a lot of state mandates. I mean, the one thing we love brokers about self-insurance is if something on the plan is not covered properly and the claim comes up, the employer has the right to say, you know what, let's go ahead and pay that claim. That's their right to do it. But then once you open up that door paying that particular claim, then you have to be consistent throughout. The thing about being fully insured and it being closed up is the carrier just says, we're not paying it. I mean, this is what our contract reads. We're not going outside the contract. We'll look at it renewal. So that's why a lot of times it can be easier for self-insured because you have more flexibility as the employer, but just be prepared to know what you know. I mean, a perfect example is like the bypass, what is it called, the surgery, I don't want to say bypass surgery, bariatric surgery, may not be covered on a fully insured platform. But on self-insured, you can have that covered if the employer wishes to have it.
Okay, just 2 slides down, the plan design options and estimated rates of pay, that would be your slide 19.
Yes.
So that MAC, minimum essential coverage plan, okay, so that's a plan basically that is, you're charging $54 a month for your employees, all right? So that's going to be covering only like, and that's going to get you out of the $2,000 per employee penalty, right?
Correct.
Okay, but it won't get you out of the $3,000 per employee that goes to the exchange.
Correct.
So if I'm an ag employer,
this would not be considered adequate coverage.
Right. So I'm an ag employer, and I don't think any of my employees are going to go to the exchange. I could get out of this whole thing for $54 a month.
And that's pretty much a self-insured, preventative-only coverage.
Right. Okay. I just and then I guess the last question is, what about layering a better coverage on top of that MEC plan that
Yeah,
that
you can.
that employees, and you could design a self-insured plan where I gave everyone the MEC plan and then offered something else that they had to pay a little bit more for.
Yeah, so what has been said on this MEC plan is there are other plans you can throw on top of it, like well, I don't want to use the term mini-med, but a limited benefit plan that the employees could still buy that as a voluntary product too.
Right.
So again, you as the employer could pay this $54 amount, and then the employees, if they wanted more additional coverage, is buy the limited benefit plans that could cost like $100 a month.
So,
and that would
so
give them flexibility to go to the doctor, and maybe like 10 times a year.
Right.
Could have hospital coverage on there as well.
Is the government gonna throw these MEC plans out? I mean, it seems like
the government does catch up pretty quickly on these things. So yeah, I mean, when this was first brought to us, we basically said this doesn't pass a sniff test. Something's going on. So yeah, I have a feeling that the government will catch on.
Right. And then I was talking to a lawyer who said that he thinks that the IRS is going to be a little bit more lenient with these things because they've gotten so much of a black eye, already, that they're gonna, they're not gonna want to, for the first few years anyway, they're not going to want to take on these things because they guess they are legal.
Yeah, I mean, right now they are legal. It's going to have to be a change.
Change in the law.
I mean, what's that?
A change in the law that they do by policy.
Yeah, I mean, that's pretty much. It's, as you know, these do get tweaked, once a month or so. It could be something small here you guys never hear about. Eventually, when they start seeing maybe a mass enrollment on this product, then you could probably see a change.
Got it. Okay, legal for now. So getting back to that 9.5%, I know I shouldn't want to bother you or just keep going on this, but a lot of our employers have both husband and wife working for them. So if I have both the husband and wife working for me, and I know this is putting you on the spot a little bit, but if I had both the husband, it just bothers the heck out of me. So how do we manage the 9.5%? And so I've got a husband and wife that work for you, right?
Right.
So now neither one of them is a spouse, correct? Because both of them are employees, right?
So usually what happens, I'll stop you right there for a second. Usually what happens when you have two employees that are married on a plan, most likely, and I would say like high probability, those employees are on an employee plan, employee premium, because the employer is subsidizing that premium for them, right? The spouse is not going to be covered on the other employee's plan because most likely that employee has to pay the full premium for the spouse.
Right, I get that. If I have two employees that are working for me, they're both going to want to be covered as employees, not one person covered as an employee and the other person covered as a spouse, because we require them to pay a lot more for their spouse.
Yeah.
Okay. So that's the answer to your question. If married employees work for you, each employee is covered as an employee, and each one, you're going to take the 9.5% of that employee's wage.
That's exactly right.
Wow, that's pretty tricky. Thank you for answering the question.
Sure.
I'd have never been able to figure it out in my own little brain.
Well, Dan, it's like, what would be cheaper for you if your wife worked with you? It'd be cheaper for her to be on the plan as an employee than it would be a spouse. Especially, I don't know what you guys are doing, but especially if the responsibility of the employee is to pay 100% of the spouse for children's coverage.
You want to know what WAFLA does? We pay 100% of the employee's premium, and we pay 0% for their spouse's premium.
Right. Exactly.
We're not covered by Obamacare anyway, so we don't care. But I mean, that's because I'm a small business located in Olympia, WA, and every person that's any good here, I steal them. It's from the state. I mean, that's who my competitor is. It was in your first slide. So I got to have health insurance. It doesn't matter what Obamacare says. I got to have health insurance, or I'd never have an employee that could read or write in this office. And so so I just cover the employee 100%, and if they want to buy for their spouse or kids, they can pay 100% of that. They can pay 100% of that premium. Yeah.
Yeah.
So
you kind of go back to what you're doing. Then, if your spouse worked for you, she'd be covered 100% because she's an employee.
Right. It makes so much sense when you said it. Just I would never, I was getting wrapped around the 9.5%. Okay, so I think we got all of our questions answered. It's 10 to 12. John, you're a great American, because normally these things go over and it's 5 after 12 and we're losing people. This was a super little session because it really shows the benefit of kind of reviewing things. I think people understand where they're at now, and they should take the time to know their numbers, I think is what you're saying. Pick up the phone and call a broker. Pick up the phone and call their CPA, and get some information. In most cases, information is free or relatively cheap, and then make your plan from there. Whether it's Yep.
There's some work to be done. It's not going to be done in a week or two. So if you can, get started as soon as possible.
Perfect. Hey, thanks a lot, everyone. Thanks you. They'll be able to make their lunch dates. Next week we're gonna have one of those. John, you might want to tune in for that. I'd love to pick your brain a little bit about it. It's Freedom Care. It's a minimum essential care coverage layered onto a plan that you buy. I saw it down at an ag show in California, and I'll tell you what, John, it was selling like hotcakes. I mean, the ag employers down in California are going to this thing, and so we're looking at it right now, and so I wanted to get the word out. So I'm going to be running it by you with your permission.
That'd be great.
Hey, thanks a lot, John. Thanks for the information this morning for our people, and everyone who tuned in and asked questions, and even the people that didn't ask questions. Thank you very much for attending. See you next week. Bye.